Traditional technology for prostate cancer diagnosis and treatment offers limited options for doctors and patients. Wide variation in confidently targeting prostate disease location is a key influence in developing recommendations to select surgical treatments which are often accompanied by negative and extreme side effects. Now there is a better option for gathering diagnostic information about the extent of prostate disease. Better diagnostic information provides a basis for understanding and selecting from a variety of treatment options that are less extreme and have fewer negative side effects. The TargetScan stereotactic biopsy and treatment system offers the first real advance in prostate imaging, biopsy, and treatment in over a decade. The system allows a physician to image in 3D space, precisely plan and undertake a stereotactic multi-sample biopsy of targeted tissue mass in the prostate. TargetScan provides added confidence for the physician in identifying not only the presence of cancer, but the likely location of the cancer. The targeting capability is the basis for improved diagnostic results for diseases of the prostate. In this video, we will very quickly demonstrate effectiveness, ease of use, targeting accuracy, and resultant diagnostic confidence that comes through the use of TargetScan. The future is now. The current end-fire and side-fire ultrasound technology is an accepted tool for diagnosing prostate cancer, but has many problems associated with it. Since the probe is handheld, placement has limited control and tends to distort the prostate, which significantly reduces accuracy of the results. Current technology requires the expertise of a very experienced physician to provide the kind of handheld control that contributes to the best results. Most of the time, this is the urologist handling the case. In this setting, the movement of the probe is also very uncomfortable for the patient, who in turn finds it very difficult to not move. Patient movement contributes to missing planned target locations, a potential reason for not clearly knowing the extent of disease. As a result of the limited targeting accuracy, doctors and patients are left with limited treatment options, generally the most invasive and extreme. The TargetScan stereotactic biopsy and treatment system offers many advantages over traditional technology. This system significantly increases accuracy of diagnosis and treatment by utilizing robotic technology in a motionless probe and scanning process. Once the probe is positioned properly, it remains stable and motionless. The prostate is scanned and mapped in its natural position, providing an undistorted 3D image of the gland and target sites. The TargetScan images provide very accurate results without distorting the prostate. Hands-free scanning, mapping, and biopsying of the prostate are all achieved with the use of the TargetScan touch screen. The interface is very intuitive, easy to use, and provides unprecedented views of the treatment area. Initial scanning of the prostate is quick and easy. The viewing planes can be easily changed while the probe remains motionless, thus providing added flexibility in diagnostic information gathering. Biopsy core planning can be customized or can follow pre-programmed templates for 12, 16, and 24 core plans. Target sites can be easily and quickly adjusted by simply adding or deleting points on the target map. TargetScan supports multi-sample, repeatable biopsies. Physicians can come back to the same target sites in the future with confidence the previous locations are accurately known. Patient plans and images are easily stored for quick recall at any time. The TargetScan system provides patients with benefits as well, including more treatment options based on better diagnostic accuracy, shorter recovery times, and better outcomes with fewer side effects when optimal treatment options are chosen, less intrusive and more comfortable diagnostic processes.
The TargetScan Touch allows us to do a stereotactical, if you would, procedures on the prostate. I think that most urologists, after they've had a 5 or 10 minute in-service on exactly what the biopsy approach is accomplishing, once they see that, their interface with this machine via the touchscreen is going to be extraordinarily simple, very intuitive, and they'll be very, very early and quick adopters. Urologists can have great confidence that biopsies they are taking are truly arising from the positions within the prostate they are seeking to biopsy.
The TargetScan has allowed us to do these procedures using similar technologies, but with a fixated probe within the rectum. Once I place the probe in the rectum, the probe is there to stay, and I don't have to touch the probe anymore, and the rest of my attention is directed toward the actual performance of the biopsy.
Quite a number of the men that I've used it on have been men who previously had a conventional, hand-driven, two-dimensional biopsy of the prostate. And like most men, they sort of rate it as probably the worst experience in their whole life. The TargetScan Touch, because once we place the probe in the rectum, we do not secondarily and tertiarily move it. The patient knows what to expect, and overall, the patients have been more satisfied with this biopsy approach than with the conventional biopsy approaches.
The TargetScan Touch supports precise placement of treatment devices. Use of the motionless probe gives physicians complete confidence that needle placement is precisely directed to the cancer targets. The placement of the implant can be monitored in real time with sagittal and transverse plane access to ensure accurate delivery. Needle placement for treatment with the TargetScan easily locates desired targets, ensures a controlled treatment process providing better accuracy and improved outcomes, supports existing workflows and compatibility with existing leading treatment planning systems.
Well, the benefits of TargetScan Touch for brachytherapy as well as for cryosurgery is that it takes away this manual manipulation of the probe to try to find where your needles are. Now there's no more guesswork as to where the seeds are dropping. You can actually see the seeds drop, and it really enhances, in my opinion, the efficiency of the procedure.
Because the TargetScan Touch does not require repositioning of the probe, I can actually monitor in real time as I advance the cryo needle into the prostate, and I don't have any artifacts related to movement of the cryo probe.
The cryosurgery procedure is only as good as the ultrasound that you're using, and certainly this has been a great tool to increase the efficiency, because I don't have to worry about manually moving the probe and checking one side of the prostate versus the other, and in terms of how it is freezing. It's a wonderful technology for focal therapy, and the principal reason is that you're marrying targeted biopsies and targeted diagnosis to targeted treatment. You're not doing a subjective biopsy and then you want to do an objective treatment. You can't, it just doesn't work that way.
I think that this affords us the best opportunity we have now to do very accurate focal ablations of the prostate.
From a financial standpoint, the TargetScan system has been proven to offer an accelerated return on investment by providing a high volume capability and by offering system administration by technician-level staff, an option that does not distract physicians from more productive clinical time. Thank you for your interest in the TargetScan Touch system. For more information or a demonstration, please call today. You will find more detailed information on the web at www.envisioneeringmedical.com.